Ian Adams to come to the front. James is an experienced AI solutions leader with a strong background in consulting, project management, and cross-functional team leadership. Over the past 3 years, he's delivered large-scale AI projects in predictive maintenance, anomaly detection, and data-driven insights. He's scaled AI solutions for infrastructure management and pollution control, driving measurable improvements in securing long-term client partnerships in strategic delivery. His experience includes shaping sector-specific use cases, policy recommendations in healthcare, education, agriculture, and SME enablement.
My talk today is going to focus around how AI can transform Africa in the healthcare space, shifting things from just being reactive to a more predictive space. And I think the importance of AI and healthcare is that it comes down to saving a life. And I think that's the important part we need to touch on, is that the right decision saves a life, the wrong decision loses a life. So it's a very important aspect we need to take into consideration when we're talking about this. It's a case of, this research was, we got a grant from Google to conduct this research. It's more qualitative research, and it essentially combines our AI innovation with ALU's leadership approach to delivering real impact in Africa. What we've also done in terms of this research is not just speaking to healthcare, but at a broader sense, critical areas like agriculture, education, and also entrepreneurship, which we refer to as SME enablement. And we've been doing this conducting this research for the last year and a half. We are getting to the point now where we'll be publishing things in the next month or two, if I stand corrected, John. But yes, we're heading towards the closing end of that research. So I'm hoping that after this, that you get access to it. It is available online already in its draft form, and it's meant to be more insightful and more impactful in terms of there needs to be a real outcome instead of just another white paper that's been written. So the key message for us has been in setting the scene is that there is so many challenges faced in the healthcare space. AI offers a unique opportunity to leapfrog some of that, and people might say the West is ahead, but in terms of looking at a developed versus developing landscape, AI can actually cause that acceleration a lot quicker. I am originally from Cape Town. I grew up in a very small town called Macassar, which is, if everybody knows Somerset West, is on the False Bay coast. I now reside in London with my family, and in my life experience, I've seen in so many ways how healthcare can touch those close to you. I've seen it with my two daughters, one born very healthy, the other one born with a lot of complications, and the importance of the healthcare system in that process. So this is not just another talk for me, this is quite personal in how I look at AI and how it really has to have a proper impact on people's lives. And in terms of the overall agenda, I think there's a couple of messages that I want to just lay out and just looking at the agenda. One is that Africa has a unique challenge and an even greater opportunity. I think that's the big piece. The second part is, here's how it's already working in Africa, and we'll take you through that and beyond. And then finally, here's what needs to happen next, so that together we can predict ethical healthcare systems for Africa. And I think that part, ethical, is an important aspect to it. So just to set the scene, we're going through I've spoken through all of this, but the important part is that AI is being used to leverage, it doesn't replace. Expertise really still comes from within in each of these sectors. So a doctor still requires that expertise. It's just about, are we allowing our doctors, our nurses, giving them the most important priority information to make the right decision at the right time. And I think that's the important aspect to this. It's about tackling healthcare in a way that is providing equity in a space that's quite uneven. I've been exposed now to healthcare in South Africa and in healthcare in the UK. And in terms of just equity, it's still very much uneven, regardless of which system you're looking at. I look at when I grew up, my grandmother used to go to the clinic around the corner, the lines is outside, medication not always available at the right time. All those aspects we need to consider when we're looking at healthcare. So today, my conversation is going to be about the entire ecosystem. We'll dive into a couple of use cases, and then we'll jump into a little bit more key insights from the reports as well that we picked up. So in terms of healthcare leaders, there's a lack of data, real-time data to act on decision making. We're seeing that in terms of outbreaks, we see detections far too late. By the time we do want to make a decision, it's spread already. We see in terms of clinics needing stock, by the time people really need life-saving medication, there's nothing available yet. We see maternal deaths, so going untraced, we're making prevention nearly impossible. And these key insights, set out what we need in terms of, without this visibility, our leaders will face even further, struggles in this space. Now, from getting to a point of reactive to predictive, there's 4 steps in that. So data, insight, decisions, and action. So if you're capturing the right data, that right data turns into the right insights, and that's then supported better in decision making, and then allows people to act early. If you get that first quadrant wrong, everything else falls flat. So in a space where there's a lot of structured and unstructured data, it's important to work at a local level to understand what you're looking at. In my consulting days, I worked on the Old Mutual project, a big digital transformation portion, and I was fortunate enough to work on the medical, translating the medical data coming in, so from pathology to reports and that. And just think about if I got just the formatting wrong on that, what impact would that have on someone's life when they go through underwriting in terms of whether someone's HIV positive or negative. And so that's the realities in terms of getting data right when we make these decisions. So next, I think we've spoken a lot about theory, but in terms of, let's move more from a theory to a practical sense in how predictive healthcare systems are working in the real world. Got this case study in terms of Rwanda. In Rwanda, the Ministry of Health, they saw material deaths rising due to paper-based systems. Once clinics were digitized, AI dashboards gave visibility across the districts. They were able to reallocate ambulances to the right places, update referral routes, and save some lives. Now, in terms of that, this is not just inevitable. With the right system, people can make the right decisions, not just in a matter of days, but in a matter of hours. We see that in terms of all of this, we've seen that there could be real insights in terms of understanding pandemics or epidemics in countries, and we've seen that with some local AI models that's taking place. So out of our research, we picked up 1 or 2, I think 4 use cases we've looked at. This one is very much around how do we predict risk and protect mothers. So AI is helping that in terms of identifying higher risk pregnancies early, and this is in rural areas. So in Kenya and Rwanda, you see AI models really being able to look at the prenatal, demographic, and socioeconomic data that allows each and everyone in that community to be able to understand, okay, what they're working with in terms of intervening early. How do we reduce emergencies, and how do we get to a point in which moms can actually get the the health care they need before something happens. I mean, my wife, when we had our firstborn, she was healthy throughout the pregnancy, and at birth there was complications, and that complications we had to work with doctors for the next 4 years to rectify. The good doctor from Netcare, I must thank you for, my daughter spent 2 years in Netcare, from ICU to procedure after the next, and I think that care and that system is what I was privileged to have access to. But if you look at Africa, there's a lot of people in rural areas who don't have access to that. So if something goes wrong, baby goes home with mom, there could have been something happening that the doctors weren't aware of, so that post-op, the post leaving the hospital could also have an impact on the life and death of a mom and that child. So I think even in these instances, we see that there's clear benefit in using AI. There's many rural clinics which lacked proper data records. We've seen that shown to earlier. We've seen that models need diverse, more high quality data. And it requires, actually, from an AI perspective, you need to be quite local in your implementation. So with us working with the Ministry of Health in Rwanda, we've got teams on the ground that go to the clinics, sit with the nurses, go through things, understand exactly what's happening. That informs better in terms of the solutions that come out, the tooling that they're using, and also improves the experience in which doesn't hinder, their day-to-day work, but actually it makes it more efficient in that sense. In terms of AI for outbreak and triage prediction, we've also seen a use case in terms of that where models are taking clinical, environmental, mobility data to detect early signs of disease clusters, and then using that in terms of predictive dashboards to alert the ministries and hospitals to prepare for increased cases. So that's some powerful stuff. That's not just taking a hospital account, clinics, geographical location, and using things like WhatsApp just for triaging. So these things are already happening. I think the important thing that we'll get to is, how do we do this at scale? I think that's the challenge that we're really facing in an environment where there's quite a disconnect between various stakeholders, from government to private and public sector, as well as the patient itself. So how do we do this at scale? There are so many questions people ask. So how do I identify a pandemic early? What is the disease burden? What does the child health policy be? What would that be? How do I allocate resources properly? How do I train effectively those that need it? And is the right policy being financed? And those require all aspects of the entire value chain to be involved. This is how we've done it. We've implemented AI in 3 very important pillars. We looked at linking digital connected clinics, government, and we've developed a government intelligence center and training even the nurses and academics in country to give them that real-time visibility and in-country ownership. And it's about scaling that predictiveness, not just in projects, but entire systems. But it doesn't stop there. It starts with working with various partners across the board. You're looking at, in Rwanda, partners like Starlink, solar networks, drone delivery, connecting every clinic. This has resulted in 126 health posts being digitized, near to 600 workers being trained, 65% faster call center responses, and 10 ministries having to collaborate with each other to deliver. So that brings, AI is not just enabling, it's also bringing people together. And in order to that, it's also a place in which you can actually start successfully investing in your health ecosystem. I'm not going to do this demo today. You'll have to wait for part 2 tomorrow if you're here, just to keep you on note. But essentially tomorrow we'll run through some real case scenarios in terms of what this has done in terms of situational awareness for the country of Rwanda. But we don't just stop at data, we have to look at the impact. And I think that's always where you need to focus on. I've looked at this so many times and gone, like, how do you look at this and not say that AI doesn't have an impact? We've seen that how the entire health system is working faster. We've seen that 38% of health posts now have dispensing just based on data being available. We've seen fridges being allocated for cold storage. We've also seen an improvement in terms of attendance, in terms of learning modules, because people now want to learn and understand what they're working with, and they're seeing the results of that on the ground. But it's also a case of government and policymakers realizing the impact it can have and sharing that across countries. So we've been fortunate enough in the research to go to multiple African countries and see how ministries are starting to share that information. So I think a lot of people want to do something that has an impact. It's about just bringing it together. So what do we need to get ready for this? I think in terms of our research findings, there's some core policy infrastructure readiness that needs to take place, and a lot of the presentations today have touched on that. A digital infrastructure that is connecting our clinics and health posts with reliable data. We also have trusted and accessible data ecosystems. I think the transparency, accountability of what's being developed is going to be an important aspect in terms of how we regulate it. And also we're going to need partners and investors across the sectors, government, public, private, donors, to scale this sustainably. So where to next? I think I wanted to share some takeaways in terms of what we've learned on this journey thus far. There is important aspect of digitize before you predict. So you have to get the data right. So strong data foundation will set up how you connect things. And the important with that comes in things like power, connectivity is a very important aspect. So if there's no power or connectivity in that area, that's infrastructure that needs to be set up first. Data quality determines trust. So inconsistency or incomplete records undermine like the model value and also the confidence in how that can serve clinicians. Design requires ownership as well, and human ownership. Currently working in the utility space in the UK, which is highly regulated. And the first issue that we always see is like, who owns the data? Because the person that owns the data would be responsible and accountable for it. So I think that's going to be an important aspect here is, in order for us to adopt tech correctly, we need to have the right ownership in place as well. We'll touch on personal data ownership tomorrow, because data is a real asset to the patient as well. We'll go a little bit in what's important around that. And then ethics and accountability it also builds confidence. So it's not always nice. Don't think that doing things in a black box is going to give people trust in what you're delivering. So taking people on that journey is an important aspect. I think a big learning curve has been like, you need to start local before you scale nationally. So the importance of working with that contextual learning on the ground, being at the clinic posts, has been a huge learning curve for us in terms of understanding what needs to happen at a national scale. And partnerships really drive that resilience down the line. So silos between policies or ministries or tech and implementation delays progress. And I think, again, when it comes down to it, it's going to require a cohesive system in which to do that. And the biggest thing that we always say in our company is, and our CEO likes to use this, and it's very important to do, you got to do hard things to do really great things and have a real impact. So I think bringing this together is going to require hard work from everybody. So thank you everyone again for allowing me to speak today, and I hope you have a look at our reports and would like your feedback on it. Thank you very much.